Hello everyone, this is Dr. Madhusudan Rao and the program I teach medical students. Today I talk briefly on the topic blood supply of brain. There are two pairs of arteries, that is a pair of vertebral arteries, a pair of internal carotid arteries that supply the blood to the brain. Well, the vertebral arteries they arise from the subclavian artery. They enter the vertebral canal at the level of sixth cervical vertebra. After entering the brain, they join together at the lower margin of the pons to form basilar artery. Basilar artery terminates as posterior cerebral artery. They give rise to the branches to supply the medulla, pons, midbrain, and the cerebellum. Coming to the internal carotid artery, after entering the brain through anterior perforating substance, divides into a large middle cerebral artery and a small anterior cerebral artery. Middle cerebral artery and the anterior cerebral artery, they supply the most part of the brain. That is the cerebrum. Well, what is cerebrum? Cerebrum is a part of the brain that lies to proximal to the brainstem. Then what is the brain? Try to understand this particular anatomical divisions of the brain. Brain is the proximal part of the neuraxis, proximal to the foramen magnum. That means brain is defined as that part of the neuraxis proximal to the foramen magnum. It comprises of cerebrum, the brainstem, and the cerebellum. Yes, the cerebrum is further divided into two hemispheres, two halves, which are connected by a band of white matter called corpus callosum. It is important to understand this terminology. Well, commonly we call the cerebrum as brain, but by definition, brain comprises of cerebrum, brainstem, and cerebellum. Well, this picture shows the cerebral hemispheres, the brainstem, and the cerebellum. Viewed from lateral side, and viewed from the medial side. Lateral brain, this picture shows the area demarcated by the red color, which is the middle cerebral artery territory. That part of the brain showing red color is supplied by middle cerebral artery, a branch of internal carotid artery. And yellow color is the anterior cerebral artery territory. That means the anterior cerebral artery supplies the most medial surface of the brain, besides a part on the superior surface of the frontal and the parietal lobes. The posterior cerebral artery, its territory is demarcated by blue color. It supplies the most part of the occipital lobe and a strip of the parietal lobe superiorly and a part of the temporal lobe in its lower part. So these are the parts of the brain supplied by middle cerebral artery, anterior cerebral artery, and the posterior cerebral artery. Then we'll try to see certain of the pictures showing this vascular system. Here you see the vertebral arteries. Can you view the patient from the right side? The right vertebral artery arising from the subclavian artery, entering into the vertebral canal at the level of 6th cervical vertebra, runs in the vertebral canal and enters the cranium. In the brain, it joins the opposite vertebral artery to form the basilar artery, which terminates as posterior cerebral artery. If you look at the internal carotid artery, which enters the brain and divides into middle cerebral artery and the anterior cerebral artery. Look at this slide describing the arteries of the brain. As I told you, two pairs of arteries, internal carotid and vertebral arteries, with their extensive branches, supply the most parts of the brain. The two vertebral arteries, branches of the subclavian arteries, enter vertebral canal at 6th cervical vertebra, as I told you, ascend through foramen magnum, and at the base of the brain unite together at the lower margin of the pons to form basilar artery. And their course gives branches to supply medulla, pons, and cerebellum, and courses into passes in the that is center of the pons and terminated the lower terminated at the rostral margin of the pons into posterior cerebral arteries. Rostral margin means it is upper margin of the pons. The internal carotid arteries ends at anterior perforating substance and divide into large middle cerebral artery and a small anterior cerebral artery. This is the picture I showed you already, showing the arteries, the internal carotid artery and the vertebral arteries that are supplying the brain. Well, circle of Willis. The students are expected to know about the important vascular structure, that is circle of Willis. This is six-sided polygon of arteries at the base of brain. That is major arteries of the brain, that is basilar and internal carotid arteries. They are connected together at the base of the brain in the interpeduncular fossa to form the circle of Willis. That is, this vascular structure lies in the interpeduncular subarachnoid system and contributes most part of the blood supply to the brain. Then how it is formed? Anteriorly, the two anterior cerebral arteries, they are connected together by anterior communicating artery. Posteriorly, the basilar artery dividing into two posterior cerebral arteries. And laterally, it is bounded by the posterior communicating arteries that connect the posterior cerebral artery with the internal carotid artery. This is how the circle of Willis is formed. Right? So what are the functions of this particular circle of Willis? So as you see, the great vessels, that is the vessels of the internal carotid stream and the vessels of the vertebral stream, in the brain they are connected together by the blood vessels, that is the anterior and posterior communicating arteries. But as such, there is no mixing of the blood in these two streams. When there is a vascular block, the circle of Willis provides the alternate route of collateral circulation to the brain. This is a very important role played by the circle of Willis network. Well, you find sometimes berry aneurysms in the vessels of circle of Willis. And rupture of the berry aneurysms results in subarachnoid hemorrhage. This is few points related to the clinical significance of circle of Willis. Well, to know this certain important branches of vertebroplastinal system and carotid system. Vertebral artery gives rise to anterior spinal artery and posterior spinal arteries to supply the spinal cord. Posterior inferior cerebellar artery supplying cerebellum through the inferior cerebellar peduncle. There are meningeal branches given by the vertebral arteries and it also gives rise to medullary branches. Basilar artery gives branches to the pons, anterior inferior cerebral artery to the cerebellum, labyrinthine artery for the internal ear, superior cerebellar artery, and ultimately terminates as posterior cerebral artery. These are the branches of the vertebrobasilar system supplying the brain. Coming to the carotid system, as we mentioned already, middle cerebral artery, posterior communicating artery, anterior choroid and anterior cerebral arteries, and ophthalmic and anterior communicating artery branches of the anterior cerebral artery. This is the vascular network from the internal carotid artery stream. And to look at the branching pattern of the cerebral arteries, they have the cortical branches and central branches. The cortical branches of the cerebral arteries supply the superficial layers of the brain, that is cortex. Central branches supply the internal structures of the brain through anterior medial group, anterolateral group, posterior medial group, posterior lateral group, and choroidal branches. Well, through these branches, they supply the internal structures. Internal structures like basal ganglia, internal capsule, they are supplied by these internal branches. Well, this is a brief note, brief discussion on the blood supply of brain. Well, before we conclude, we try to mention few important features of the brain. Brain is a metabolically very active organ, right? It derives its energy through aerobic oxidation of glucose. It is glucose that provides energy to the brain. Brain is around 2% of the body weight and it receives more than 20% of the cardiac output. The oxygen consumption of the brain is more than 20% of the total oxygen consumed by the body. Well, and this organ is very sensitive for hypoglycemia and hypoxia. If hypoxia continues, it undergoes irreversible damage. The damage starts in a period of 10 seconds and completes over a period of 4 minutes. And if the hypoxia persists for more than 10 minutes, there is brain dead. A situation from which patient may not be able to recover. That is the importance, my dear students, to know the blood supply of brain, which should be continuous and uninterrupted, either due to vascular block or due to circulatory failure. Thank you very much for patient listening. If you like my video, please subscribe to my channel. We'll meet again in the next class. Until that time, bye bye.